This is Case 4, Reinventing Healthcare, from the USG members Jan-Christoph, Jan, Vanessa and Ala. The sales pitch. Today's healthcare systems are struggling with increasing costs and an unsatisfying cost-benefit ratio from the patient's point of view. It seems like the most important figure, the patient, is not in the focus of the current system. Nowadays, the system is supply-driven and focused on the physicians. The new model will move the patient into the center of the healthcare system. The new structure focuses on value improvement through better health outcomes and more efficient care. To implement the new strategy, we need the following 6 components. Part 1. Organize into integrated practice units. The medical teams are divided into new specialized teams which are called IPUs. They have specialized in a certain disease or disorders and related conditions. The IPU engages with families to provide counseling and education about the medical conditions so that they will actively participate in the whole treatment process to improve the outcome. Furthermore, the IPUs take care of the full care cycle and serve as a supervisor during the process. Part 2 is measure the outcomes and costs for every patient. The majority of today's healthcare providers do not measure the outcomes of medical conditions for the individual patients. Although the measurement of the value is key in improving healthcare, in which the only true measurement of quality is the outcome that matters to the patient. The outcomes should be measured by medical condition. Outcomes that matter to patients fall into 3 tiers. The first tier is the achieved health status. Tier 2 outcomes relate to the nature of care cycle and recovery. Tier 3 outcomes relate to sustainability of health. Part 3 is the bundled payments. The payment approach best aligned with value is a bundled payment that covers the full care cycle for acute medical conditions, the overall care for chronic conditions for a defined period, or primary and preventive care for a defined patient population. Providers benefit from improving efficiency while maintaining or improving outcomes. Bundled payment would, for example, include the hospitalization, surgery costs for drugs, physician or radiologists. The fourth part is integrate care delivery systems. Currently, there are most multi-site healthcare delivery organizations that offer duplicate service. To increase value systems, they have to be integrated. The integration process consists of 4 key components. First, define the scope of services. Providers have to focus on service lines they can offer effectively and accordingly with high value. One possibility is to reduce the range of service lines in contrast to the current approach of offering everything for everyone. Second, concentrate volume in fewer locations. Multiple studies have shown that higher volume in a certain medical condition has positive effects on the value. Due to the increasing volume and centering process, the providers are becoming highly experienced in their medical field, which A. leads to qualitatively higher outcome for the patients, and B. enables significant cost reductions. Another key component is delivering specific services at the locations where the value is at its highest. Matching capabilities and skills needed with the existing resources of a location is a major problem of the current system. At the same time, it provides a huge strategic chance for raising productivity and cutting costs. High-cost settings like teaching hospitals should shift routine services and low-complex conditions to more convenient, cost-efficient facilities. The final step of integrating the health system is to integrate the care for patients across multiple locations. The IPUs are the main entity and should manage the full care cycle. Initial evaluations and complex treatments are made by a centralized IPU, while recurring services like continued therapy needs to be performed at single locations. Part 5 is the geographic reach. The geographic expansion is one of the main points to be focused on while talking about IPUs and improving value. Therefore, the geographic expansion should not just focus on increasing the volume, but rather focus on improving value. First, I would like to start with the hub-and-spoke model. The hub-and-spoke model is a system of connectors, which are arranged like a wire wheel in which all traffic moves along spokes connected to the hub at the center. Especially by using the hub-and-spoke model for a new healthcare system, for each IPU, satellite facilities are established and staffed at least partly by clinicians and other personnel employed by the parent organization. In order to be as effective as possible, some clinicians rotate among locations, which helps staff members across all facilities feel they are part of the team. Now I would like to show you the second model, the clinical affiliation model, based on the example of the Cleveland Clinic. The Cleveland Clinic's Heart and Vascular Institute act in this example as the IPU, which partners with community providers or local organizations using their facilities rather than adding capacity. The Cleveland Clinic has 19 hospital affiliates spanning the eastern seaboard and provides management oversight for clinical care, and some clinical staff members working at the affiliate may be employed by the parent clinic as well. Local affiliates benefit from the expertise, experience, and reputation of the parent IPU. The IPU broadens its regional reach and brand and benefits from management fees, shared revenue, or joint venture income and referrals or complex cases. Part 6. Building and enabling information and technology platform. To enable the preceding 5 components, an information technology platform has to be established. We would suggest to develop a smartphone app that consists of the following 6 elements. The first component is centering on patients. The platform aggregates all relevant information of the patient. Secondly, the platform uses standardized data terminology in relation to diagnosis, treatments, and lab values. The third element is encompassing all types of patient data in a single place, so every patient of the care cycle has a compressed overview of the relevant data. The fourth component of the platform is enabling full access for the physicians and patients on the health records. The next important element is that the system includes templates and specific systems for each medical condition. Conclusively, the app structure allows its users to extract information about the care cycle easily. The platform also enables the patients to report outcomes on their care during and after their care is completed, which optimizes clinical decisions. Especially with the background of the current technological progress, developing an app which integrates all stakeholders' interests and information in one platform is a crucial factor of success for our strategy to reinvent healthcare. And now I'd like to thank you for your attention.